Are you ready, kids?
Oh, I'm a gummy bear. Yes, I'm a gummy bear. Oh, I'm a yummy, tummy, funny, lucky gummy bear. I'm a jelly bear, cause I'm a gummy bear. Oh, I'm a moving, grooving, jamming, singing gummy bear. Oh yeah, gummy, 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 gummy bear. Gummy, 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 gummy bear. Fighting by dolly party, pointing by dolly party, pointing by dolly party, party pop. Pointing by dolly party, pointing by dolly party, pointing by dolly party, party pop. Oh, I'm a gummy bear, yes, I'm a gummy bear. Oh, I'm a yummy, tummy, funny, lucky gummy bear. I'm a jelly bear, cause I'm a gummy bear. Oh, I'm a moving, grooving, jamming, singing gummy bear. Oh yeah. Three times you can buy me.
Sai si Jane Melia.
Christian J. S. Dizon,
Arcajan P. Victoria.
Ryzen Messiah,
Jala Shia M. Javier.
Mula sa bulwagang pambalitaan, himpilan at sandigan ng bayan. Ito ang News Express.
Isang mapagpalang araw.
ito ang inyong tagapagbantay.
at inyong kaagapay. At kayo'y nakikinig sa
News Express.
Comparing the prescription medicine from over-the-counter medicine in terms of their chemical properties and uses.
There are two general classification of drugs: prescription only, RX only, over-the-counter, OTC.
Para sa mga detalye,
prescription-only drugs are only available with a valid prescription from a prescriber. These drugs are heavily regulated and required a visit to a prescriber, a diagnosis, and monitoring by a prescriber to ensure the medication is working and that is working safely.
Over-the-counter drugs are available for purchase without a prescription and can be purchased right off the shelves at the store without a visit to a prescriber or consultation with a pharmacist. OTC medications are not intended to be specific individual, although depending on the medication such as cream, eye drops, or nasal spray, the user may want to be the only consumer for the medication.
Prescription drugs are intended for use by one individual patient to treat a specific condition and when starting the medication. Each patient is legally entitled to speak with pharmacists about the medicine. Prescription medicine must pass through many clinical trial phases, approval by the Food and Drug Administration or called FDA, and monitored for safety and side effects even after the drug is on the market.
OTC drugs are monitored by the Food and Drug Administration, but it is not as strict as the process prescription drugs must go through. Manufacturers are required to make drugs only based on a specific dosage to be on the market.
Although OTC drugs are available without consulting with a prescriber or pharmacist, the patients need to be aware these days still carry a risk. Some OTC drugs could cause drug interaction with prescription medications or cause more adverse effects. It is important to mention to a prescriber or pharmacist about all of the OTC drugs being used to follow the recommended dosing instructions on the label.
Less soluble.
Prescription medicine.
Commonly soluble.
Over-the-counter medicine.
Typically more potent and have higher risk of toxicity.
Prescription medicine.
Considered safe when used as directed but still cause harm if taken in excessive amount.
Over-the-counter medicine.
typically more reactive.
Prescription medicine!
Reactive with other medicine. Chemical unstable due to complex formulation and higher potency.
Prescription medicine!
Designed to be stable. Can also contain organic molecules with multiple oxidation state.
Prescription medicine!
Can also contain organic molecules with multiple oxidation state.
Tanging ina! Ngayong araw, we will discuss the examples of
Over-the-counter medicine and the prescription medicine. Erika, sis, can you give naman example of over-the-counter medicine?
yes, of course, so cover a analgesic, helps treat mild body pain, and then anti-diarrhea, helps treat lost bowel movement or LMD, lost watery and frequent defecation, and then anti-acid, helps control the acid level of the stomach and relieve the pain and discomfort caused by such a condition. And then antipyretic, helps lower blood temperature during a fever. Anti-inflammatory, helps re-swelling of the body parts due to infection. And then antiseptic, helps prevent the spread of pathogen. And then decongestant, helps relieve nasal and chest congestion and difficult and breathing caused by building up of phlegm and mucus around the nasal and bronchial lining. Laxative, helps regulate normal bowel movement and it also relieve the pain of discomfort caused by constipation.
Thank you, sis, for answering my question.
So, it's your turn, Sisi. Give it to us yung mga example of prescription medicine.
There is like antibiotic. This can destroy the pathogens or harmful microorganisms that cause a disease. There is also the antihypertensive, help control and maintain your blood pressure. There is also the depressant. This can make your mood and make the body feel relaxed. And there is the necrotics. These are the medicine that can relax the body and cause numbness. And lastly, the stimulants. These energize the central nervous system.
Pauwiin na! Goodbye,